Okay, good. Thank you. Thank you for joining us. Over the last 18 months, we've negotiated 25 collective agreements with public sector unions representing 35,000 public sector workers, 18,000 of which are healthcare workers, nurses, teachers, social workers, just to name a few. The Association of Allied Health Professionals has now decided to walk away from the bargaining table and conciliation. This is very unfortunate. Given this development, we are now able to speak publicly. What we have offered AAHP is fair, respectful, and consistent with what we have provided to other public sector unions. Our proposal to AAHP provides generous wage adjustments, factoring in adjustments for competitiveness and recognition of long service similar to or the same as those negotiated with other unions. A leadership premium, a signing bonus, and a process to address their concerns regarding fairness and compensation amongst their members has been offered. This approach demonstrates that recruitment and retention of health professionals is a top priority for this government. As I mentioned, we feel that our proposal to AAHP is fair and consistent with other public sector unions, including nurses, doctors, and teachers. In all our discussions, AAHP's 750 members, which include professionals such as pharmacists, physiotherapists, and audiologists, remain foremost in our thoughts. We value the important work that they do for the province, as well as all of our healthcare workers. They're essential to us. We are ensuring fairness in our approach while balancing this with our fiscal responsibilities. We remain available to meet with AAHP and have now requested the Minister of Labour to consider the appointment of a mediator to assist the parties in concluding collective agreement. Thank you. I'll take questions. Thank you.
What is it that you're hearing from AAHP that they would like to see that's not really meeting their needs right now?
What we're hearing is they want generous wage increases, and that what we're hearing from them is they want equality across what I'm going to call the healthcare profession. And we've offered them the process for that, and we've offered a generous wage package. So I think it's important that that we continue to have a dialogue and try and work towards a collective agreement here. So yes, we're hearing from them that it needs to be more. We think that we're being very fair, very respectful, and very consistent, and we have to be. You know, we have 18,000 healthcare workers have accepted now their collective agreements, so we have to be that. But we also are trying very hard to work with the allied health professionals to find a path forward to reach an agreement.
Were you surprised that things took this turn?
Well, they've been public for quite some time saying, talking about their frustrations. I will say that we would have hoped that conciliation would have continued. The conciliator was still available to us and was still involved and we were still back and forth. But now we have to move on to a different process, and we respect that and we understand that. That's why we've asked for a mediator now, to see an external mediator, to see if we can make some path forward, because I think that's going to be essential.
I'd like some more details about this process for equality across healthcare that you mentioned. What was the process that you suggested to them?
So we've had discussions with them. This has been one of their concerns. They wanted to make sure that their concerns at the table would reflect what they call equality. You've seen that in their press releases, that where they're using that word. They want to have recognition under the classification system, and we've offered them a process for that. And I can't get into any more details except to say that that has been offered to them.
I have a question, but I first want to give you an example of pay inequity within the job evaluation system, which applies to AHP. So there's like an AHP class, for example, of prosthetist orthotist 1 that's assigned 811 points, more points than the registered nurse 1 class, which has 784 points. But the AHP prosthetist class is paid less despite having more points. I'm just curious why and how did some AHP classes receive less compensation than other classes in other bargaining units despite being rated higher by the JES?
Well, I will say that we have a classification system that is part of the job evaluation system that was put in place in 2015 that all unions agreed to come on board with. They were worked very closely, I believe, with government at the time. I wasn't in government at the time, but I can tell you that they were there at the table. And the process of the job classifications came from that. That is, we've heard from Allied Health that they're concerned about the way that those classifications are determined, and we've offered them a process to consider that moving forward.
I guess, related to that question, my sources tell me that Treasury Board was aware of this JES pay inequity as early as, I want to say, summer 2020. I'm just wondering why, after 4 years, has Treasury Board not corrected that pay inequity?
We have, I can't recall exactly what you're referring to. Something that might have been at the Treasury Board table, but I can say we have been dealing with and talking to our unions and dealing with and talking to the job, to classification experts in the job evaluation system, and that's why we're able to now offer, we were prepared to offer Allied Health a process to move forward. So that was part of the bargaining process. Anything further that I need to know, or no? Okay, I'm just making sure I didn't leave anything out.
I guess I'm just wondering, if the goal of the JES was to achieve pay equity, why did this government make the conscious decision to continue to use this system, even though it resulted in this pay inequity that the AHP is concerned about? Again,
this is a job evaluation system that was state-of-the-art in 2015. We've been working with it, working with all unions. You've only heard this from AHP at this point in time. I will say that we have offered a process to AHP to make changes to the job evaluation system and to the classifications. We've offered them a process for that.
How long will that process take?
That's something that I can't get into details today because it's part of the discussions that we're having with AHP.
What are the next steps with mediation?
So we've written to the minister. Asking him to put in place an external mediator. The minister, which is Minister Bernie Davis, will consider that request. He will determine if it's the right approach to go forward, because we've had a conciliator on this, and there's, this is really just another dispute resolution possibility. He will determine whether or not and whom should be involved in any external mediation. Once that's determined, we'll sit with AAHP as required under the Act and see how we can find a path forward. And that's the intent here. Look, we've worked very, very hard to make sure that we've been fair, we've been respectful, and we've been consistent to all of our groups that have come before us, and we've worked very hard to achieve. And I think it's been successful. 35,000 people have been able to have new collective agreements, 18,000 of which are healthcare workers, and we're going to do everything we can to try and ensure that we meet the needs of AAHP while being that consistent and fair across the board.
We just spoke with the union. They said it seems like they are ready to strike. They're preparing for that, although they haven't taken a vote yet. What do you think that would mean for healthcare and the people who rely on Allied Health?
Well, allow me to say we're going to do everything that we can to not have that happen. And we're going to continue to do everything we can to not have that happen. It is AAHP's right to move forward, and I understand that. They have to ensure that they put in essential services in place. That is part of it. Remember that there are almost an equal number of people working in other unions that offer similar services. Okay, so there's, it's complex here as well. So they have to have an essential services, then they have to take a strike vote. So we're not at that point yet, and hopefully before we get to that point, we can find a path forward.
In 2020, people with the collective bargaining division and the classification division were tasked with studying the issue of inequalities within the JES. What can you tell me about the results of their work?
I can tell you that the job classification system is something that we are constantly working on. We know that a number of the allied health, as is the right of public sector employees, often come before the classification system to say that things have changed in their jobs and therefore that they need to have a review. They're welcome to have a review. We have a process in place for that review. We also have a process in place for an appeal. So if you're a public sector employee, you have a review of your job classification, a review of your classifications. That's an ongoing. That happens. We have a whole division that looks at that. If you're not satisfied with the outcome of that, then you move on to the to an appeal process. So, you may not always like the outcomes of it, but you do have a process to ensure that that is considered.
I guess, did that, sort of informal committee, make any suggestions, though, about how to change the JES that you can tell us about?
I don't specifically know what you're asking, so I can take that away. If there's a specific report that you're looking for, I don't have it off the top of my head, but I'll certainly follow up with you if you'd like that. But it's an ongoing, you can imagine with, we have a tremendous thousands of employees. The job evaluation system classification is organic. It is being reviewed on a consistent basis, and it is being, you can have an appeal as well. So that's an ongoing process.
Has an evaluation been done within the past 3 years to determine whether or not male-dominated jobs in the public sector are paid more or less than female-dominated jobs?
We don't have female versus male-dominated job. We're basically gender neutral. So we are based on 4 key principles of evaluation: skills, effort, responsibility, and working conditions. I just had to remember them. I have the 4 off the top of my head. So those 4 are the predominant pillars of our system, and that is consistent with pay equity. And so there's not male-dominated versus female-dominated. They are gender neutral, and they are reviewed as such.
Well, that's the system, but without an evaluation, how can you know if the system is really, doing what it should from a pay equity perspective?
Because the job evaluation system was developed using the principles of pay equity and developed with the skills of not just the public service. It is a process, of course, that was also included unions.
So no evaluation has been done?
I couldn't specifically say at what point in time there would have been a job any specific gender-related job analysis, but I can tell you that our system, based on those 4 pillars, is gender neutral.
So you don't know if a gender-related job analysis sort of has been done, an evaluation?
All I can say is it would have, as part of the job evaluation system, using those 4 pillars, it is gender neutral.
Any more questions related to AHP?
Anything else that I need to add? Anybody? Okay. Thank you. I know you, do you want me to repeat what I said at the onset?
Sure. Yes,
That
please.
helped. Okay.
Thank you.
I'm happy to do that.
Thank you very much.
Weather.